And I think first thing we should do is I'll just let everybody know that the replay of this will be available via email tomorrow. So you'll get an email just like you did on Tuesday from Monday's meeting. You'll get an email tomorrow with this. It'll also be on our public Make Business Management Facebook page. And if you're part of our mastermind group, our private page, it will be on there as well. This will also be on our resources page. If you just go to the main makebusiness.com, scroll down a little bit, big red bar, you'll see the resources link button. You can click on that, and everything, all content related to COVID that we've produced lives on that one page, and this video will be there tomorrow morning. So just a little housekeeping, but I think first thing we should do, we didn't do this on Monday, let's everybody just introduce themselves real quick, and then I will let Brian and Nicole take it away.
Yeah. All right. Well, I'm working on my iPad. Nicole, you go first. I'm trying to pull up a document that I want to reference here. So go for it. You go first.
And I think everybody knows you by now, Brian. So I think you've been well introduced over the course of time. So my name's Nicole Walczak. I am the Chief Development Officer here at Meg Academy. Mike.
And my name is Mike Orman. I'm in St. Louis, Missouri, and I am a coach for Meg Academy.
And my name's Matt Krieger, and I'm the media director of Meg Academy.
And I'm Brian Gallagher, physical therapist, owner of Meg Business Management, Meg Academy. And it's my entire goal and purpose in life to see you succeed at everything you do. And that's why we're here tonight. There's my short intro.
And I just really quickly want to address, because I know we're already starting to get questions starting to flow in here. I am going to try and get to all of your questions and fold them in as we go through these topics.
That's
so
good.
Please, if I, don't answer it right away or don't ask it right away, please know that we're going to get to it. And if we don't get to it, just give me a little reminder nudge. But hopefully we will be able to answer all of your questions by the time this is all done.
Excellent.
Great.
All right, so we have a list of questions, right?
Yes.
So
this is what we're trying to do right now is really just continue on our discussion from the other day. Again, information is constantly changing. We're constantly processing all of this information. So we're really doing our best to funnel all this information through, sift through it, make sure we're getting our resources attached onto our website so that you can go back and read through it with a fine-tooth comb too. But we're trying to get you all the main bullet points out and answer all the questions that we have coming in, after we had our first session. So the purpose of this is to provide further clarification on some of the topics that we've already been covering. The first area that we tend to be getting a lot of questions as people are seeing less patients and are having to make some difficult decisions with their staff really does come in the form of asking about how to do the proper downsizing and what can I do with my staff. So one of the first questions that we have is in regards to what can I, here I'll just read it verbatim. Should I consider pay per visit rates for my PTs seeing telehealth patients? So Brian, I'm going to have you field that question.
all right, good. So I do want to add a little bit to what Nicole said. As you guys know, we put out a podcast late last night, probably hit early this morning. So we are also going to circle back to those 6 bullet points that I talked about in that podcast. A lot of you are wanting workable details on that. So I want to make sure that at the end of these primary questions that we touch on those topics, because there's a lot of people that tell you a lot of things to think about and consider. But I think it's even more important when you get the information and then we go one step further about how you can apply that information, like how you can actually gain ground, gain traction, gain benefit, gain products from that information. So we're going to try to do our best to educate, get you to duplicate what we're educating you on, and show you how we would go about applying it to the best of our ability. I'm going to have a little disclaimer. There is nobody on the planet right now that's 100% accurate and correct. It's impossible. This stuff is literally changing every single day. We are giving it to you as we understand it, as we've interpreted it, as we've done the legwork for you to the best of our ability. We literally have 2 researchers that just do research for us and help us get this information. So we believe it to be as accurate as possible, but I do want to just say things are changing, and Mike's going to talk about some recent events that literally changed less than 15 minutes ago. So with that said, I'm going to take up this question. Should I consider paying my therapists for telehealth visits on a per visit rate. So my first question is, there's several. Number one, again, there's not a one size fits all on any of these questions, right? So number one, do your therapists are they currently employed full-time as exempt employees? They should be full-time exempt employees. If you're still a physical therapy private practice owner out there today and you are paying your therapist hourly, my eyes are going to fall out of my head. There's no single good reason why you should be treating your therapist as a non-professional and paying them hourly for the services that you're providing. I can make multiple arguments why that's going to be working against you, because you're actually going to be paying for documentation time, and you actually are treating your therapist, you're going to be paying for documentation time, and you're literally not giving them the professional standards that they deserve as a licensed professional. So they should be salaried. Let's say the salaried employee doesn't want to work a full 40-hour salary. You can give them a prorated salary. You can give them prorated benefits. You can hold them accountable to being a member of your team and attending meetings and marketing events and special events because they're still a salaried employee. The minute you treat them like a redheaded stepchild who doesn't want to play nice with others and you just pay them hourly, they're going to come in, do their hours, and go home. The mentality of that position completely changes. So if you have that hourly therapist and you're going to convert them to a per visit, I guess that could be done. You cancel their existing status sheet and you reestablish them as a new employee under that new circumstance. But I am going to definitely ask you to refrain from doing that. I don't see any reason why you should do that. You have better options. I would just simply take advantage of the short-term compensation package for your state. We are going to have on our resource page a list of every single state in the United States for you to link to, and you can learn about these are all the same things. The employee assistance program, the short-term compensation program, the work sharing program. These are all programs where you can reduce their hours and let the government pick up other hours so that you can fully treat them as the professional that they deserve. So that's my answer to that. I don't want to really go and encourage people to do that because I just don't think it's an appropriate way to handle it, especially since this is a temporary situation. I think you have better solutions. So that's my long-winded answer on that. But we will have links that you can go read. You know, that's my opinion based on my experience, but we have links for you to go read the resource directly and you could formulate your own opinion based on your state. I mean, the other question on that is, are you in an at-will employer state or not? I mean, that's a whole nother thing. If you're not in an at-will employer state, you have some definite jurisdictional guidelines that you may be violating by flipping people around between salaried, hourly, and per visit. That could be a problem.
Okay. Can you speak specifically on, because we had one client call in and talk about the Florida Reemployment Assistance Program. Can you speak specifically on how that works in particular?
Yeah, you know, we have printouts on just about every single state in the United States. I think we have every state. We may be missing some. These, you know, work sharing programs, let's just call them work sharing programs. That's one of the most common terms for this. These work sharing programs all have slightly different rules and regulations because it's a state by state sort of thing. The federal government first enacted it in the 1982 tax bill, I believe. So this has been around for a while. So I went ahead because the person who wrote in a question, as Nicole's highlighting, is from Florida. So let me just read off the Florida one as an example because the other states are going to be fairly similar to this. So the employee's responsibilities in this are going to be that the employee must be a full-time employee. No part-time and no seasonal employees are eligible for this plan. Number two, they must meet the established requirements to the application format of the program. I'm not going to go through what all those requirements are. They're on the application. You just basically have to meet every little checkbox on the program, within the application of the program. While on it, you must work and be paid for the hours that you're worked. No fraudulent, yeah, sure, they're working and I'm not paying them just to get the money from the government. None of those shenanigans. Don't pull any of that off. If you reduce their hours and they work X amount of hours, you must still pay them X amount of hours, and then the government covers the delta between their full-time down to what you reduce them to. And I'll get to what they can be reduced to. You need to report the hours worked and or paid leave. Paid leave could count as hours worked in Florida, at least. So it could be hours worked, or hey, I'm also so they worked 10 hours this week and they cashed in on 15 hours of paid leave, whatever that may be. And that has to be reported every 2 weeks. Oops, two weeks, every 2 weeks, right? It has to be reported every 2 weeks. Same with your payroll period. Just stay on your payroll period. You must have the employer complete the application. It's good for 1 year and it can be renewed yearly. This is Florida, but notice the application must come from the employer to get into the system. And then what will happen is the employer will enlist or enroll employees as they're already in the system, okay? At least 10%, but no fewer than, thank you, my little assistant. Perfect. At least 10% of your staff or people within a particular department, if you're a big company and you're just going to look at one department, but for most of us, it's our company. At least 10% of the employees within your company, no fewer than 2, because you could be a small clinic and you don't have that many people, no fewer than 2, at least 10% of your total staff must have hours reduced. This is important, especially in Florida. You just can't cherry pick. You have to reduce hours across the board, reduce at least 10%, and then you're eligible. The employer must submit an employee's name and normal full-time working hours as part of the process. The employer must certify that they will be reducing the employee's normal work week hours by at least, and here's what's important. If you have the employee in the program, you have to reduce their hours by at least 10%, but no greater than 40%. Again, this is Florida. So if they're a full-time 40-hour employee, if you reduce them down to 30, that's 75% of total. That's a 25% reduction. You would qualify for the program. This is a temporary arrangement. And interesting, this is an interesting part. Because this is a temporary arrangement and you're having the government supplement the delta between what you reduce them to, typically when people receive unemployment benefits, they have to be able, able, reviewing, and going out into the community seeking employment. That's one of the requirements for unemployment. You have to be doing. That's waived in this shared work program. That is waived. They don't have to be demonstrating that. But what they do have to demonstrate is they have to demonstrate that they have maintained their availability to come back to a full 40-hour work week at all times. So they can't be collecting the check and then fill their time with something else that would prevent them from coming back full time should they be called back into work on this program. This is a temporary arrangement and they have to be able to do that. This is one question that I think most people are going to ask, so we're just going to handle it right now. Brian, if I put somebody on this program and they're currently on our 401k or they're currently in our simple IRA, who covers the health insurance while they're on this temporary work sharing program? It's the employer. You, the employer, must continue to pay any benefits that the full-time employee was enlisted in at the time that you reduce their hours. So if they're in health insurance, they're in short-term disability insurance, they're in retirement plan, you need to continue to cover those. That stays because they're still your employee. And that's what we want, right? I mean, this isn't for employers to try and get out cheap. This is not the point. The point is to help our staff win and succeed in a very tough time. So take care of your employees. Remember, your employees, this is just my own personal thing. Your employees are your business. Don't think of it any other way. Your employees are your business. So that's Florida as a good example. And I hope that gives you a good picture.
Yeah, and that is Florida specific. Everybody is different, or every state is different.
Yes.
And I know Sarah had typed in and said it works a little bit different out west where she is. So make sure you are aware of your specific state programs.
Yep.
And use the links that we have provided for you.
Just to jump in, everybody, on the resource page at the very bottom under practice management, there's a link to the PDF Brian was referring to just now. So has all the states and all the links on the PDF.
Great.
Okay.
Super duper. Thanks, Matt.
We're going to stay on the topic right now before we jump over to the telehealth topic, because I know people are anxious to get into that, but we're also going to stay on the topic of this unemployment. We have another question from somebody that said, what happens in regular times after a company's unemployment fund is fully dispersed to employees that have decreased hours?
That's a good question. And Mike, you're going to chime in and help me out on this one too, because you know, Mike Gorman here is a very experienced physical therapist, very successful, ran multiple offices in the state of Missouri. So he's had, you know, a lot of employees and a lot of experience over the years, so I want to hear from him as well. But under normal circumstances, my understanding is that the unemployment is an unemployment insurance fund. So you're paying unemployment insurance premiums. When under normal circumstances, an employee goes on unemployment, this is you probably already know this, but for those of you that don't, when you're paying a certain premium for unemployment, when an employee goes and then collects unemployment, the next thing you should be prepared for is that your insurance carrier who's housing the unemployment benefit for you is going to circle back around to you and attempt to raise your premiums. Now, how crazy is this, right? You have to have unemployment insurance to be in business. And then heaven forbid, you go through something and you have to use it. You get penalized for using it for the best interest of your employee, right? So that's normal circumstances. People are asking me what's going to happen now. Are these things going to be suspended? I don't know. I don't have a crystal ball, but I can tell you what, if your unemployment insurance carrier attempts to raise your premiums because you go through a pandemic and people are needing to get unemployment benefits during this pandemic because the federal government shut you down, not of any fault of your own, I think you have a major reason to fire up, talk to your state association, call us, get us fired up and get us to get behind you and help you. There is no way any insurance carrier during this period of time should have a leg to stand on to raise your rates when you're trying to protect the salvation and put food on the table for your employee. That's my 2 cents, Mike. I don't know if you have anything to add to that. Maybe we have so many people on this Zoom. Maybe somebody has some experience they could write in the chat and maybe Matt can chime in after you.
So I don't ever like to point out that Brian's ever wrong because we know that doesn't happen too
I
often.
hope.
But so he talked about unemployment insurance fund or unemployment insurance. So I always look at it, and at least the way it is in Missouri, it's an unemployment tax that we as the owners have to pay each year. So what happens is when the employee files for unemployment, you as the employer do not pay that unemployment. But what happens is there's an unemployment fund. And so the more unemployment claims that your employees of your company produce in a year, that does mean that next year, under normal circumstances, next year, your unemployment tax would go up. Of course, no one knows. Hopefully that's not going to be the case now, but that's typically, at least in Missouri, it's an unemployment tax that we all hate paying, and maybe we don't understand it, but everyone has to pay into this fund. It's just a matter of, oh, I got a yes, that's correct. Anyway.
Mike, you are correct. It is not a private carrier fund. You know where I got myself confused on that because there's so much, the workers' compensation, right?
Yes.
Workers' compensation. I was thinking about the workers' compensation fund where you have a private carrier that covers you on that. Mike is right. This is a federally funded thing, but it still operates the same, right? I mean, where if you use it, they're going to penalize you is the main point. I'm sorry. And that's why we have a panel, so we can help each other out. So thanks, Mike.
Yeah. We have another question along that topic, and I just want everyone to kind of hear it. But if you have to reduce a full-time employee's hours by, let's say, 20 hours, can they file for partial unemployment? And how does that work?
Not according to the example I gave with Florida, because you decrease them beyond the 40% marker. So in that situation, again, every state's different. I think you really have to go off the resource list that we have and see what your state says. But the intention there is that it's a work shared program, right? And I think if you go down to 50%, you might have a little bit of a trouble there, but every state could have different limits. I think you need to the answer is check your state.
And I will chime in too. Just here in Maryland, I know on Monday, the governor of Maryland released a ton of COVID relief funds and spoke a lot about unemployment and a lot of funding going to unemployment. And I know there is partial unemployment here in Maryland. So definitely check your own state to see what the new rules, even just this week, have come out most likely.
Yeah. Yeah. It's definitely a state, which is why we're going to put the resource list together, so that should
Okay, good.
handle that.
Okay, good. So we're gonna kind of jump topics a little bit back to the telehealth topic. Again, I feel like we kind of stimulate more questions when we give more information, just because, there's a lot of unknown right now. But can you further clarify the e-visit versus telehealth visit, in particular, how we're billing for these in terms of modifiers and what codes
Yeah.
we're,
Yeah.
we're supposed to be using? So
I wish we had our billing director, Allie, here. She knows
I
this
know.
like the back of her hand, and she's
She
a
does.
wizard. But we had a good consultation today. Things have been changing literally. What was it, Nicole? Like almost every other day, right? I
Right.
mean, we're just getting information every other day.
And,
So what,
and just, I want to point out, there is a resource that we have on our resource page, and you'll notice that it's dated March 18th, but then it's like a working document, and they're updating the little sections as time goes on. So it may say, March 19th on one little section, or March 23rd on one little section. So, make sure you scroll down. It's a very current document.
yeah, that's really good to point out. So if you guys are understanding what she's saying, when you go to our resource page and you look at the document, the resource link, you look at what it is regarding this topic of telehealth and e-visits, you're going to say, oh man, that's dated March 18th. So much has happened between now and then. We know that, but if we kept posting, the list would be just all the way down. So what we did was we just kept that document, and every time there was a change or alteration or modification to the programs, we just went in the document and redated and gave you the updates. So you'll have a current information for every single question and subheading within that document. That was the best way we could manage that. I do want to say one thing before we leave this topic, Nicole, if I have your
Mhm.
permission.
Yes.
I do think there's still a lot of people that are thinking about this work shared program, right? Or short-term compensation programs. It depends on what you want to call it, whatever state. Again, I think we've answered that. There's also two other options. There's furloughing employees, which means they are still an employee of yours. They have been temporarily laid off, but you are going to continue to support by covering their benefits during this temporary layoff with the intentions of them coming back to their full position. That's the idea. So that's option 2, I guess. And then option 3 is a full layoff. You've downsized, you've eliminated the position, you're going to operate off of a full layoff, and that person no longer has any intentions on coming back, nor do you have intentions on rehiring them, and you're not obligated to carry any portion, benefits or whatnot. They're let go from your employment. So Mike, I think I got that right. Now that I'm really scared now. I want to make sure my checks and balances are right. We're good?
I think so, yes.
Okay, so layoff, furlough, and short-term compensation or work sharing. So let's move on to the.
And I have a question. How long for furlough? And I think that's a variable. I think, it's typically alluding to more of a short-term layoff, but there's flexibility within that. I mean, obviously within this unknown time too, we don't know what that's going to be, but I've seen like even up into a year, you could be considered furloughed. So there is a lot of variability.
Yeah, you're really right about that. And when you go to our resource page, we put a really good article, a link to a really good website article on what does it mean to furlough, what does it mean to lay off, and what's the pros and cons and differences. Literally, whether we tell it to you here or we give you the resource where you can get the resource directly, I think that's even more valuable sometimes. Yeah. So please go there, click that, and read about it. Most of them say with furloughs, I think the two most important things are it's agreed upon time that they're temporary off, and it's clear to both parties that they are remaining as an employee, their benefits are covered, and they're coming back. So yes. It's usually an agreed upon. And typically, I would say, like Nicole, I do think you're right. It can go out like a year, but I think typically what they say is most of the times it's like 90 days. It's like month to month, 60, 90, 30, 60, 90 days. It's stuff like that. That's the most common use for furlough, right? It's not intended to be long-term. So
yeah. And the question that we got
on that?
The question that we got is, what if we can't hire them back after furlough?
Okay. What if we can't hire them back after furlough? Interesting. Well, I don't think you go bankrupt or anything. I don't think there's any penalty to you. I just think the intention of furloughing and carrying them is what was the originally agreed upon intent. But if you ultimately, let's say the 90 days comes and you're like, you know, there's no way I can bring you back, we're just going to have to make this a permanent layoff. I think then you just change the game. You make it a permanent layoff at that time because the intent didn't happen and you guys just have to separate and part ways. Again, research your state, look at the article on our resource page, make sure that you're doing what's legally allowable within your state. And it does depend on if you're at will or not at will employer state. Those resources are there. But as far as I've read, I've not read anything that you can't change your mind down the road if circumstances were to change. I've not read anything about that. But again, I haven't read everything.
And Jeremy from New York is saying that, yes, after furlough, it would be a layoff.
You could be a layoff. Yeah, that's my understanding as well. So thank you everybody for chiming in. Some of you on here have read things in particular. That's great. Keep it coming. Keep sharing. We are watching your chats.
Okay. So now we can jump to telehealth if there's no other questions on the employment stuff. Okay. So can we further clarify in your notes from Allie, because I know we talked about this in depth today, how are we properly billing out, first of all, classifying e-visit versus telehealth, which e-visit is all pertaining to Medicare population, whereas a telehealth visit is alluding more to all the other payers. If we talk about e-visit, first of all, we can only talk about an existing patient, correct? We have a question trying to identify what is an existing patient? Does it mean that it's an existing patient that you've done the eval and the plan of care was established on site and that's an existing patient? Or, you know, they were a patient in the past and now they're coming back. Can that be qualify as an e-visit? Do we know, you know, what the
Wow, those are great questions. Those are super great questions. And I want to preface this by saying this is all very new content. So there's not a real long precedence with this. So Mike, you're going to have to sharpen your hair and stab in here with me and help me out a little bit on this. But I'm going to start.
I will jump in and say that I know what I have read is that they have to have an established plan of care on site, from my understanding, from what I have read. So my interpretation would be, you know, they would have to come in for a physical evaluation. You establish a plan of care in person, and then at that point you can transition to an e-visit. But again, you can't force that on them. It's more of a, you know, they have to come to you to say, you know, I have this need for the e-visit.
There has to be an established plan of care and an active plan of care.
Mm-hmm.
Yes. So that's great because I was going to add that too. And I got a lot of my information from Daniel Seidler from TelePT Solutions.
Yeah.
And he and I have talked about this on multiple occasions. And from what I've read and from what I understand, and I think I've covered this and read through the PT in Motion, top 25 questions on this topic. We have the links. If you haven't read it, you absolutely need to get there and you need to read it because I think it clarifies this quite straight up. Number one, my understanding is they have to be, and I think it specifically says, they have to be an active patient in your billing system. They don't say EMR, they say your billing system, which I thought was pretty fascinating that they picked that terminology. But the patient that basically has to be an enrolled active patient within your billing system. The intent of an e-visit is not to be rehabilitative physical therapy. It's not telehealth. An e-visit is not the same as telehealth. An e-visit is intended to be done over the phone, over a patient portal, but now they've waived that and you can use Skype and FaceTime and, you know, Zoom and, you know, all that. So it's intended for you to help a patient through a problem, particular situation or circumstance or confusion. So you're going to be reaching out to them, which is why it's a 7-day period from the first time you reach out to them. Over the next 7 days, you add the amount of minutes you spent helping them or assisting them through their, whether it be their home exercise program, they have confusion, and whether you're going to be Zoom talking to them about proper sit to stand from their lazy boy, that they're just not getting their hip right, or whatever they're having a difficulty dealing with. You're going to spend time helping and aiding your patient for safety and security in the home as it relates to the condition that you were treating them for. But I think it specifically says you are not operating off of that plan of care. That is not what an e-visit's for. It does not, you do not have to be rehabbing them in accordance with the plan of care. This is not intended to be a replacement visit for them per se. This is an idea that you're communicating to avoid further regression or problems with the patient. So your documentation has to be clear as to the intent of the call or the intent of the Zoom session, as to what you were addressing, what were you aiding them with, what were you helping them deal with so that they didn't suffer greater complications or regressions, okay? So that's the idea of the e-visit. My understanding too is you get 1 7-day period. I'd love to see somebody type in the chat. Maybe Daniel's on this and he can chime in. I'd love to hear from him. My understanding, it's 1 7-day period. Whatever minutes you have, that's what you clock in. There's no renewing another 7-day, another 7-day, another 7-day. That is not my understanding. If somebody knows different, it's a one and done thing. Total minutes 21 or greater, G 2063, 11 to 20, G 2062 is your code. Less than 5 to 10 minutes is G 2061. But when you use those codes, you have to add your GP modifier, which we all know if you know billing, the GP modifier is indicating that it's a physical therapy service, and you have to indicate that this is a catastrophic event, and you're going to put the CR modifier. Both of these need to be, for the most part, as I understand it, I'm trying to be as accurate as I can. If somebody knows something different, please let me know. Both of those codes need to be in there so you can get reimbursed for these visits. Mike, you're really good on telehealth. What do you got there? Well, this is obviously e-visits.
Yeah, no, I mean, I think unless someone can tell me otherwise, what you said with the e-visits is correct. Jeff has a good question. So he says, so if that e-visit is a 10th visit, do you do a progress note? And Brian, you talked about that because the e-visit is not actually a visit. It's just kind of my interpretation is a 7-day period of checking in. So you can't do a progress note off that.
Yeah,
Right.
You're not doing, that's not the intent for that, right? So
and Daniel is asking if he can chime in. So Matthew, can you activate Daniel's mic?
Yep, I'll bring him in right now.
And we're getting some feedback from some of our other panelists that are saying 1 7-day period, 24 hours off. The next 7-day period can be initiated. However, it needs to be patient initiated with every issue.
That's an important point.
Move.
All of this has to be patient initiated. You can notify them that you're doing it, but they have to initiate the need for the service or the want for the service.
Yep. And I think you've already said it, but the maximum, to reiterate, is 21 minutes per 7 days. That, you can't bill for more than that.
Yep, that is the maximum. Now, Jeremy, you said 1 7-day period, 24 hours off, next 7-day period.
So that sounds like you can
I'd like to see where that reference came from. I've not read that. I'm not saying he's wrong.
Daniel's chiming in here. So maybe he can.
Daniel, I don't know. I wish I read that before, but.
Can you guys hear me?
Yes,
yeah. Hey, Daniel.
Okay, great. No, I haven't seen that either, Brian. That might be the case. I'd like to see that reference. It makes sense. My sense from the initial information put out by CMS and confirmed by the APTA is that this was a 7-day stopgap and that a new policy would possibly be coming for the following, after the first 7 days. As of now, all we know is that for the first 7 days, that's how things are being handled.
Daniel, you haven't heard, maybe Jeremy's getting some information ahead of everybody else. You haven't heard that this may be a workaround the Medicare issue, since Medicare, we do not have PTs on the roster for telehealth, and maybe they're going to somehow sort of give this temporary 7 days, 24 hours off, 7 days, 24 hours. Obviously, we all agree this has nothing to do with rehab. This is in by no way going to achieve the same outcomes and progress of telehealth. But I'm just kind of trying to reach at straws here. Like, where would that come from? Because
I think Jeremy is clarifying. So it was in the PPS webinar today, and he said if they have an in-person visit in the middle, it has to be more than 24-hour gap.
Gotcha. And the in-person visit was missing. Thank you, Jeremy, for that clarification. That makes all the sense in the world.
Yeah. Okay, good.
Okay.
I think that
So far, they still have only, the regulations that are out there only allow for that first 7 days.
Yeah. But this was, you're saying, Nicole, what you read
this
here
is
was
new information as of the PPS webinar today.
Today's
that
PPS
if
webinar.
they have an in-person visit, in between, then it would have to be a 24-hour gap before they would initiate a second 7. Is that right, Jeremy? Yeah.
Yes.
There has only been a 7-day cycle. No one has gone further yet.
My
Right.
dog is here and I'm afraid she's going to
That's
start
being
barking. So take care of my puppy.
Mia.
Okay. All right. You know, life happens at 7 o'clock at night, right? 7:30 at night. So
Yeah.
yeah. All right. So Daniel, I'm with you. I love the fact that Jeremy threw that in there because
Yeah.
that is just like hot off the press. So by tomorrow we will have read
Yes.
that. We will have that data assimilated and we will have it posted.
Yes, and we
So
have
that-
the link now because Jeremy shared the link with us, so we'll make sure we put the link on our
Jeremy, you're
resource
the
page
man.
too. Thank you.
Thank you for sharing that with so many people. You're helping not just us,
Yeah.
but everybody on this call.
Yeah,
So thank you so much. That's what this is
round
all
the
about.
ball. Okay, so can we talk a little bit more towards the telehealth topic?
Yes.
How we're billing for that?
Yeah, Mike,
service.
why don't you take the lead on this? I feel like I'm
Yeah.
doing all the talking and you have some good knowledge on this here too.
So it's important from a telehealth standpoint that we need to first of all find out, does your state allow telehealth? And then secondly, you need to find out if the state does allow telehealth, is the insurance going to reimburse you for it?
So let's
So-
stop with the state. Let's break it up into parts. Cause I know if I'm sitting here and being a therapist listening, I'm like, okay, Mike, that sounds good. How do I do that? How do I find out if my state has telehealth coverage?
Well, you want to, first of all, really look at your Practice Act and see if it's in the Practice Act. But in a lot of Practice Acts that I've looked at, there's not any mention of telehealth. So my advice is to give the state chapter office a call, speak with the executive officer or
Yeah.
whoever's in that office to find out if the state even allows it. And
That's
so,
what I'd say, yeah.
and that's why a lot of people are now looking at the PT Compact as a great way to do telehealth in different states. And from a PT Compact, those of you that don't know what the PT Compact is, it's, I believe, 20 to 25 states right now have starting in 2017 or 2018, states started to form this PT Compact. And so it would be easier. For example, I work in Missouri. If Arkansas is in our compact, it'd be easier for me to cross state lines and work in Arkansas if I was part of the Arkansas compact. So, but just because you can join a compact in a different state doesn't mean that you can do telehealth in that state, because it's going to defer to what your state practice is.
Okay.
Yeah.
Gotcha.
And I had another question come up, and basically saying there's a lot of gray area and not understanding of like if the services are going to be reimbursed for example, for an initial evaluation, because they use the term existing patient, and when they try and call to get clarification, you kind of don't really get answers. I know one of the things that we talked to Allie about, when you are trying to get information about whether or not telehealth services are going to be covered, one of the things you can do is call your provider representative. Not the number on the back of the card is going to like get you to a generic person, the call center that's not going to be as helpful. If you get your contract for that particular provider, that particular insurance company, and call your provider representative, you may be able to get better answers. And it's hard to blanket give you an answer of like what's going to be covered, what's not going to be covered, because it is so provider specific, state to state specific. So it's impossible for us to say what is or what is not going to be reimbursed. So you have to do a little legwork on your end and make some phone calls and get to the right people that are going to have the answers for you.
So just to kick this back over to Mike. So step one, Mike says, go to your state licensing board. In Maryland, it was called the Department of Mental Hygiene. In Florida, it's called the Department of Health. In your state, it's called something, right? What's it called in Missouri, Mike? Who issues your PT
It's
license?
our Board of Healing Arts.
Yeah. So every state has a different, go there first, find the Practice Act, find what the state is permitting and not permitting, step one. Step 2, if you don't get good clarification there, go to the APTA state chapter and try and get your answers there. Step 3, because I've had a lot, and I just want to be straight. I want to keep it real. I don't want to sugarcoat things. I'm a huge supporter of the APTA PPS, but I am getting flooded with PTs calling me, reaching out by emails saying I am not getting good, straight answers from my state chapters. And that's a shame. And I just want to call it out. So any of you state chapter members that are listening, please step up your game, be committal. Stop being so wishy-washy. Stop trying to not take liability and be all litigiously defensive. These PTs who are members are calling your chapters needing answers. They don't need, all these generic kind of things. I can tell you if you're not getting the answer you need from your state, please step it up. Go to Sandra Norby, not her. Don't call her at home, but she's a wonderful PPS president. Go directly to PPS and they will give you the answers you're looking for. I have full support and confidence that they will lay it down for you, just like the webinars they've been doing and just like the posts they've been putting out daily. It's been excellent. They've been doing an excellent job. And then step 3, we just gave you a huge tip. Your front desk coordinators all probably know, hey, I got to verify telehealth benefits. I'm going to flip over the insurance card and call the number like I always do, or I'm going to go online to the website like I always do, and I'm going to attempt to verify telehealth benefits for this patient. Number 1, do not go to the website. They are out of date. They can't keep up with it. The information is not reliable. It is just not reliable. Do not do that. We have a billing company where we do billing with hundreds of clients around the country. We have people that just specifically do this all day. This is what they're telling us. Do not do that. Do not flip the card over and read the number on the back. It's going to go to a call center. It's going to be offshore somewhere 9 out of 10 times. They do not know what's going on a minute by minute basis, as what we all know is happening here. You must look up, if it's Aetna, pull your Aetna contract. Who is your representative? Who's the Aetna rep for the St. Louis, Missouri area? If it's, obviously you're going to have to do this for every carrier. You're going to have to call Aetna, Cigna, United Healthcare, Humana, Blue Cross. It tends to be, from my billing team's communication, tends to be that the Blues are pretty much on top of this. You reach out to them, they have answers for you. They're going to give you definitive things. But what you need to ask, and Allie gave me a nice list of questions to ask, which I'm going to go over with you. But I just want to make sure, Mike, did I say that? Did you have anything to add there? Because I think we're already to the point where they're calling each insurance carrier and getting it, and they're asking, what is the coverage? Is it coverage and parity, the same as office, same as telehealth? And what is the reimbursement? Is the reimbursement and parity, same as in office, same as telehealth? Because some of these, they are not. They are giving you telehealth reimbursement of $36. We don't care what you do. We don't care how much time you spend. It's $36. It is not. You're still going to use your codes. I'd like to hear Daniel chime in about the CPT codes on telehealth. I'd like to get a little clarity from him on that. So maybe he's still listening. But Mike, did I bring us to the right point, at the point now where we're like verifying insurance here?
Yeah, I think you're right. I think that, yes, more states right now are starting to mandate telehealth coverage, but I would just caution, and Daniel can chime in too, that when they're saying that there's a mandate right now, is it just for this 3-month period? Right. Are they mandating, is this going to be part of the Practice Act? Because just because they mandate it, it's great for now, but now we need to stay on it and prove the outcomes that we're getting with telehealth, so that if it's not in the state's Practice Act, now is a good time to really push for that.
Yeah, and as one of our, Jennifer just chimed in, and I bet this is Jennifer S. that we know from Missouri. She said California just opened up telehealth today, maybe, or maybe it was yesterday. Maybe she can clarify in her thing. But this is awesome. I mean, literally, you have to check day by day. I know one of our clients reached in and said, Pete, Pennsylvania doesn't have telehealth. 2 days later, they said, Pennsylvania does telehealth. It's like, literally, this is a day-by-day thing. Maybe, is Daniel available? Because I want to move on to, okay.
Yes, and Daniel's going to talk about the 9-7 codes.
I'll get to that in a moment. You guys have raised so many issues, and this is such great information. And PTs need to know where to go. You need to advocate for yourself. This is definitely a moment to be doing that. I think different states are doing different things. A lot of them are putting a caveat for 120 days. Others are just putting out laws to say that telehealth is legit. You know, we're going to pay for it for all services, and mandating that some of their, excuse me, that their payers cover. It is all over the map. So you absolutely should be going to get to that representative, call the right number. That's the most important thing as far as your individual payers. And I'll say one more thing before we get to that this is a moment in time where we can really prove ourselves. Okay, telehealth is an extremely valuable service for physical therapy, and PTs can be extremely valuable to their patients using physical therapy. It's being scrutinized in a big way. So this is your time to really shine, show that your outcomes are going to be excellent. You're going to take the time with your patients. You're going to really help them through this time. And after this is all over, when the smoke clears, payers and politicians will look back and say, wow, this is a valuable service. We should be endorsing this and making this part of what's part of healthcare.
Yeah, but Daniel, that is absolutely true. And I don't mean to cut you off, but this is, okay, everybody listening, this is just my personal opinion. My personal opinion. Daniel and I had a conversation about this a few days ago. He's the owner and president of TelePT Solutions, and I recommend you get aligned with a legitimate, full force, fully equipped, fully comprehensive telehealth organization such as his, because right now, you can grab your iPhone and you could throw up FaceTime and you can go and start doing telehealth. You verified your benefits. You know what codes to use. You know what modifiers to use. And it's the wild, wild west, man. This is the wild freaking west. But I'm telling you, these days are going to end. These days are going to end. And what are you going to be left with? You're going to have to set up a patient portal. You're going to have to show that you've properly trained your staff. You're going to have to show that you have proper policies and procedures in place. You are still going to have to, at some point in time, raise the bar to the HIPAA compliance, high-tech security measures that are required under normal circumstances, under normal work environments. If you're going to go through all this now, don't sling from the hip for the next 3 months on the Wild Wild West. Get yourself, and I know it sounds like a selfish plug for Daniel, but it's really not. It's really my concern for you, because at some point down the road, you've put all this effort into something that you're just going to have to shift gears with later. So just think through what you're doing. If you've ever considered bringing in this as an adjunct service to your clinic, or if you're thinking it's time for me to restructure my business, I've been listening to Brian's podcast for the last year and a half, and I've been saying forever, if you don't move into 2020 and find a way to bring in 20% of your revenue through cash-based services, well, now is the time that proves that more than anything else. And that's how I feel about telehealth. You can go Wild Wild West, but I'm telling you, you're wasting your time, because you're ultimately going to have to get compliant. I mean, Daniel, I'm saying that with a lot more fever and vigor, but
I appreciate that. It's been a long day. I'm really tired, man. I've been on the phone all day. So thanks for saying that. Do you want to talk about coding? Should I get into that a little bit?
Let's just get into the charging and coding, and then we'll get into billing last. Let's just go through it. Like, now they verified, now they know they have some reimbursement, whether it's the Blues or whatever. Now what do they do? Now how do they do the service and how they get paid for it?
Services, essentially, you're going to schedule, I suggest at the beginning you schedule 45 minutes with a patient and assume that that's going to be 30 minutes of billable service at the beginning. So you're buffering your visits a little bit and you're kind of easing your way into it. If you haven't done any telehealth visits before, there are going to be challenges on the technical side for providers and for patients. And you're going to have to walk your patients through some of these things, which PTs are going to get good at it fast, because it's pretty easy on the technical side. I mean, you have to know what you're doing, but once you learn it, you'll be able to help your patients get connected, and make sure, most importantly, as far as choosing a platform, I've answered so many questions about which platform should I be on. Most important thing is that you have a reliable connection, that everybody wants bells and whistles right now. Get that connection going. Make it easy for your providers to get on, make it easy for your patients to get on, make that connection easy, and that the connection, the actual video is not going to break down. Okay, that it's not going to crash your computer and other things.
Do you feel comfortable just throwing out 2 or 3 names? I mean, you don't have to endorse any one particular, but maybe just give them an idea of like a few that you feel comfortable with.
I really like what the guys at Better PT are doing. They're all over this. They were prepared for this moment, sort of. Like, they were ready to go and just about ready to scale their program. about a month or two ago, and they saw that this was coming. So they really picked things up, and their customer service has been phenomenal for everybody that I've spoken with. So I really like what they're doing. They're keeping it simple, and they have big plans to really beef up their product. Mark Milligan in Austin, Texas is a PT, anywhere.healthcare. He's got a great platform, very simple on Google backbone. And last one is Doxy. People ask me about Doxy all the time. I haven't had much experience with it. I've done a demo. I liked it. I haven't spoken with them in at least 6 months, but most people who are using Doxy are happy with it. Don't expect to use their free platform. Okay, Doxy offers something for free. It's not going to be free. Okay,
how many people still think if somebody's offering you something for free, it's like score?
Yeah, it's not going to be free. It's relatively affordable, but it's not going to be free.
Yeah. No. Well, that's good. I'm glad you can throw out 2 or 3 for people. You know, the most important thing is that, you know, we try to get people connected with the best resources possible, the best partners possible, so that they are well cared for. So thank you for sharing that, Daniel.
Absolutely.
So now they're going to start doing their visits, and, you know, they have to document medical necessity and progress, just like if the patient's here. The documentation doesn't change.
Doesn't change.
Okay.
Doesn't change. It's a physical therapy visit for telehealth.
Correct. And so they're going to use their 9700 codes, right?
Yeah, that's the biggest question that we're getting is what are we billing out? You know, like, do we bill out 97110 or, you know, 97530? What are the codes that we're billing out, and can they do evaluations?
Yeah, this is once again the answer to that. The straight answer to that question is talk to your payers. Okay, many payers are it goes state by state, it goes payer by payer, it goes contract by contract, and many of them are covering evaluations. Many of them are covering physical therapy codes. So if that is the case, it's typically 97110, 97112, 97530, 97535. That's pretty much the span of codes you're going to use for PT.
Can you repeat those again?
Sure. 97110, Therex.
Yeah.
97112, neuromuscular re-ed. 97530, therapeutic activity. 97535, I believe it's patient education. And some payers don't even recognize that code.
Self-help. It's self-help and patient ed.
Yeah. And traditional telehealth, the modifier is GT, Gary Tom.
Okay. So now we're getting into modifiers, but before we do that, these codes are excellent. That's exactly what our billing team discovered as well. So we have definite collaboration on that. So you're now using you're going to use the GT, you know, George Tom, you know, modifier. Now we have been finding, Daniel, that some carriers are using the 95 modifier, but it's very far and few between, because apparently the 95 modifier correlates with some, what they call star PT codes, CPT codes rather, some star CPT codes, but some carriers are telling our billing staff that they need to use the 95 modifier. So this just shows how important it is to verify. And we also are being told that you have to use the service code of 02 for the location. Do I have that right?
I fully agree with the 02 place of service.
Mm-hmm.
95 typically requires that you code, I believe they're PCPS codes, which are qualified providers, qualified Medicare providers.
Yes.
Qualified Medicare telehealth providers. That's a tricky one. I don't know the answer. If a payer is telling you that, definitely ask again.
Well, one of the people on our chat here just wrote in saying they believe that 95 modifier is more correlated to 97161. To be honest with you, I don't even know what 97161 is. So for the overwhelming majority of us, 99%, I don't think this is something to get hung up on, but I do think it's just something to be aware of and make sure that you ask the question. I think it's always worth asking the question, but like Daniel and I are saying, this doesn't seem to be a dominant thing that most people are getting into. Oh, I'm sorry. I know what code 97161 is. It's an evaluation code.
That's the eval code.
I'm so stuck in my head on all these numbers. It's an evaluation code. Okay. So sorry about that. I'm glad. I'm embarrassed now because I'm like, what am I reading here?
It's a long day.
You know, Brian, that it still begs the question, why use the 95 modifier for an evaluation?
It does. I don't
It's not
understand it.
you're using a PT code. Why would you use a non-PT modifier?
That's why I'm thrown by it. I was just like, that's how I got sucked into my own little mystery there.
And I know that some reps are telling people that.
I know.
It doesn't logically make sense.
So here's
I would double check that.
Here's our advice on all of that. Document everything the person's telling you. If it sounds weird, it doesn't sound common or mainstream, write down who they are, when you called them, the day you called them, what they told you. You definitely have to, and look, if anybody listening to this has any questions, reach into us. My billing team, our senior staff will help you. We will let you know what we know, and we will connect you with Daniel or whatever other resource we need. But hopefully you're going to get what you need from our resource page. So I don't want to keep this thing going any longer than we need to. I think that's really good, Daniel, that we talk about that. One of the other things I wanted to just recommend as a tip, this came from our billing department. They've already done this themselves, but I think Daniel's going to support me on this as well. In your PT office, who's ever doing your billing, and if you're outsourcing your billing, you should call your outsourced billing company, or switch to us, one or the other. And you should get them to confirm for you that they have enlisted and enrolled in the email update list for every single insurance carrier, because these insurance carriers are communicating through email updates, email blasts on their changes day by day. If you're not getting those updates sent to your email, dropped into your email box, you could fall behind quickly. That's how we are staying fresh and on top of these things. I'm sure you're aware of that too, Daniel.
Yeah, I mean, that seems to be the best way. I did my own, or I'm constantly doing my own research and looking for things. I really expected more of them, and particularly the state physical therapy associations, to use social media a little bit more. I mean, this is such a great opportunity to broadcast. This is actually what Twitter was invented for. Not to plug Twitter, but I mean, in emergency situations, to be able to communicate to mass amounts of people in a very simple way. They're not doing that. Get on the email list. I agree with you on that.
Yeah, and the other problem my billing team is finding that they have cut back on their staff too. So us contacting them and getting this information takes a long time, because you can't just go through the call center. We're really trying to get to the reps. Our MEG team is set up in pyramids. Our whole billing structure is set up in pyramids. So we have pyramids that take on X number of clients. So you always feel like you're dealing with a partner, a billing partner. You don't ever feel like you're part of a big company. And what happens is we have one person we have multiple regional managers. Those regional managers are plugged into getting these communication lines from these insurance carriers, and then they filter it through their teams, through their pyramid. So although we have 45 some billers, every single one of those billers are not responsible for being on those emails. Their regional managers are connected, and the regional managers inform their teams. So we have this hardwired pretty quick, pretty fast. If you don't, you should do the same thing in your office, and you need to stay on top. It's all about the speed of information right now.
And I just want to throw in another question that we got that basically said, if Medicare is only reimbursing for these e-visits between $12 and $37 one time a week, and we don't even know if it goes on beyond that. It seems like there's not a lot of clarity there. Why even do it? Doesn't even cover the cost of a therapist. So I do want to just kind of weigh in on that a little bit. It's not necessarily just about, doing it for the money. I think it's about keeping the rapport with the patient, and also making sure they're not regressing, making sure you're keeping tabs, because we do expect this to end. And I think this kind of brings us into our next topic of, you've got to be, you made the good analogy the other day, Brian, where you're like, you're standing up. Maybe you say it better than I do.
No, you say it. Yeah, I love you.
No.
Your reiterations of what I say.
I'll stumble through it.
Oh, come on.
I'm the one who looks at the cracks. No, but yeah.
I always tease Nicole. I say Nicole's our school teacher, man. She makes sure that everybody's sitting at their desk facing forward, doing it just right. That's why she's the MEG Academy director. Just to echo what Nicole is saying right now, we are talking finances, we are talking billing, we are talking charging and coding. With that said, it just doesn't supersede being a good human. And you just have to do human well. I said that on a podcast a few weeks ago, and I mean it. I just mean it. If you went to PT school for the same reason that everybody you see here on this screen went to PT school, we went to PT school for two main reasons. Number one, we want to help as many people throughout the course of our career. We want to help as many people resolve their painful conditions, resolve their dysfunctions, and live the highest optimum condition of health humanly possible for them. And as a physical therapist, I've never wasted a minute being a PT. I enjoyed every minute treating because I knew I was having a positive influence in their life. And number two, I want to deliver an over-the-top abundance of care with each interaction I had. I'm blessed with the concept that they had choices to go to any PT clinic up and down the road. When I had my practice, there were 12 other clinics within 2 miles of my practice, but they chose to come here. So since I was fortunate enough to be the person that they selected, I wanted to give them every single thing I can and throw the kitchen sink on top of it with every single engagement. So at this time of crisis, at this time of pandemic, where people are lacking confidence and certainty, what I want to speak to you, if I'm speaking to you right now personally, forget about all these mechanics. Speaking to you personally right now, I want you to be Oprah Winfrey. Every single day from this day forward until this thing is done, be Oprah Winfrey. And what do I mean by that? Oprah exhibits calm assertiveness. You see us laughing and joking, but you see us being very assertive about what we know, but yet very calm in our delivery about it. But that's what people are going to take strength from you as a practice owner. They're not going to feel. This is why I'm like having it with some of these state APTA chapters. Like, will you please turn into Oprah for a few months here and just give some calm advice with some assertiveness so that people can hang up the phone going, that was helpful. That helped me. I want to move on to our next 6 bullet points from my podcast, because I think what I want to throw in here, and I think you're going to walk away with and appreciate, is I'm going to give you some actual tools to take off of this call that you can reform, restructure your practice so you are not 1995 anymore. And I hope I've really made my point with Nicole's comment. You do the e-visits. I don't care if you make $10. It's not about that. You know your patient's doing well. You've touched them. You've reached into them. You've called them. You've checked on them. You checked them out. That's what this is about. That's what it's about being a therapist. That's what it's about, doing what we do, making it go right. We personally, like 2 weeks ago, when this whole thing hit the fan, we contacted every single one of our clients. Are you okay? Are you doing well? How can we help? We didn't email them. We called them. Every single one. What can we do? How can we help you? We're going to create this whole infrastructure of Zoom live chat, podcasting per week, a resource page on the website. You should be doing the same thing for your patients. You want to know what to do? Call every single patient. Tell them about your new policies. Tell them about the things we're going to cover next. I won't keep talking. I just feel like sometimes we get caught up in the mechanics and we lose the personality, the personal touch of why we do what we do. And I think we have to come back to just being a good human, right? So I hope I've answered that. Let's move on to unless there's something else on telehealth. I know that bogged us down here a bit.
No. Well, I mean, we just had Sarah ask a question, and I make sure I understand the question. Can we add the e-codes to the telehealth sessions? So e-code, the e-visit, are you asking if the e-visits? I don't know if I understand.
I'm not duplicating that question, really.
Yeah. So I think e-visits are separate than telehealth. You can't combine the two. It's either or.
They're not the same thing at all, because there's no telehealth for Medicare, and e-visits are only for Medicare.
Yeah. So hopefully we've answered that, Sarah.
Hopefully, yeah.
Okay. Okay. So moving on, I think we started on this. Like, what can we do as owners? What can you do right now? Now that the patient caseload has dropped, what actions can you be taking to make the most productive use of your time at this point?
All right. So what we can do is, I recommend everybody start with this first, because, I always kind of think with the person first. I would like everybody listening to sit down tonight at your kitchen table, get a blank piece of paper out, just a simple blank piece of paper, write down on the top of that blank piece of paper, my ideal practice. Now, lots of you have heard me talk about my ideal scene. Before you do anything in life, you should know what your ideal scene is in life. Mine was to get married, to have children, to have a wonderful house, to have a awesome dog. I love having dogs. I love animals. Have a great job. I wanted to create a wonderful environment where I could give back to others. I wanted to be known for giving more in value than I've ever taken in exchange. I could picture, I want to go to the gym. I want to have an active lifestyle. I want to be on the water. That was my ideal scene. That was it. And this is a kid that, I grew up on welfare, right? I grew up on government bread, cheese and butter, food stamps, the whole thing. But I knew that's the life I wanted to have. So I decided it wasn't going to help me to get that life if I'm jacking BMWs, if I'm smoking crack, if I'm dealing drugs, if I'm cheating on my wife, none of those things are going to advance me toward my ideal scene. So I quickly knew what my life was going to be like if I'm going to have that ideal scene. Now I'm asking you something different. I'm saying, look at your PT practice right now. Maybe it's shut down. Maybe it's operating at 20% of where it should be. Or maybe you're like some of our people in Texas that are like, yeah, we got about a 15% reduction in patient caseload, maybe 20%. I'm like, oh my gosh, that's wonderful. But you could be anything in between. We've got people from shutdown to people who are suffering maybe a 20%, reduction in. But tonight you're going to write my ideal practice. Because I think when you really look at the practice you have, most likely, if you're like a lot of people I talk to, you're still practicing like this is 1995. You're focusing on, how do I get that next new patient? How do I get my therapist to treat that patient a whole bunch? How do I discharge that patient? And then how do I start this all over again, get the next new patient? I take my patient, they're here, they're hurt, we give them PT, we bring them back to being hurt, we discharge them. And let's go back and do the same thing again. And let's do the same thing again. You know what? That is not what we're to be doing. We're to be taking people that come into our door and we say, you know what? Given your age, height, BMI, works, your living situation, we need to get your optimum health is up here. Your optimum health is here. And what we are all about is getting you beyond where you were before and get you up here. And we can do that in a variety of different ways than just coming in and doing some shake and bake and seeing you, every 45 minutes, every 30, 45, every 30 minutes, whatever that may be. Get yourself to write down, what does your ideal practice look like? So moving forward, I've got some suggestions for you. First, my first suggestion is question your practice model. Question what you're doing. Do you want to stay in this insurance-only game? Do you want to continue to verify benefits, see the patient? There's people we work with that make $59 a visit on average in upstate New York. I mean, do you really want to be paid less than a massage therapist? I mean, do you? I mean, is that what you went to school for? That's insulting. I mean, it's not the massage therapist problem. I'm not critical, but it's insulting that we actually have that going on in our country. Meanwhile, I'm talking to two young ladies today who are opening up a practice out in Oregon or acquiring a practice. I'm helping them to figure out how to actually go about doing that. I do a lot of startups and we have a 100% success rate on startups. So I guess that's why we get a lot of calls, and I'm going to map out how they're going to do that. But, you're talking Portland, Oregon, Seattle, Washington, where they're making $130 a visit, $129 a visit. It's a different ball game out there. So question your practice. Here's my solution. I told you I'm going to give you go back to my podcast on the hybrid model. Go back to the webinar I did on the hybrid model. There's a hybrid model 1 and a hybrid model 2 where you can actually have the best of both worlds, because the goal here in 2020 is to get 20% of your GI in cash-based services. So think about restructuring right now. Think about, it's time to wipe the slate clean. You're coming off of this horrible crisis where you've been, and let's restructure this practice. Let's figure out how we can go out of network with some horrible payers and do some cash-based services. Let's stay in network with some great payers, and let's get paid fairly for what we do. And let's take that strategy on. So I think that's where I would start, number one. Number two, anything in your business that's not PT related, you should not be doing. Stop changing the toilet paper roll. You're the practice owner. What are you doing? Stop changing the light bulbs. Stop doing these things. Every time you're spending your mental attention units on things that somebody else could be doing, you're not running your practice. Stop doing in-house billing. And you're going to say, oh, well, you have a billing company. Of course, you're going to say that. I don't care if I have a billing company or not. Billing is a clerical data entry function. It is not physical. If I'm wrong, then why don't you put an accountant in your office? Why don't you put a bookkeeper in your office? These are outsourced services that you pay for what you need. If you need bookkeeping, call Paro. Paro is who we use. It's who we like. They do a great job for all the physical therapists in the country that we have. You need to know more about them, reach in to us and we'd be happy to help you. Nicole will connect you or whatever. But billing should be outsourced. You should just pay for what you need. But by all means, know how to pick a good billing company. Whether it's ours or somebody else's, definitely just pick somebody really good. Pick a market differentiator. You have to have a market disruptor. You have to pick something that's going to differentiate you from everybody else. Are you doing good laser? Are you doing good dry needling? Are you providing the newbie e-stem, which I'm a huge fan of? I'm all over my podcast. I talk about it at PPS. I talk about it at CSM because it's one of the most innovative electrical pieces of equipment that you can build 97112 and do activities and really handle the autonomic nervous system and see people with lumbar radiculopathy and be 5 and done like nothing I've ever seen before. Just go to www.newpttech, N-E-U-P-T-Tech, or reach into us. We'll connect you. Jason Waugh is the founder of that. He has done wonders for my clients. It can be a cash-based service. It can be an insurance-based service. It goes both sides. I got one for you. I've got somebody who I absolutely adore who's working with me to develop, and I'm just going to pull it up here on my phone because I was reaching out to her today because I said that I wanted to talk about her on this chat. She's a nutritionalist, and she can do this through Zoom. And her name is Jillian, and you can reach her at Jillian@livewellbeyond.com. Jillian@livewellbeyond.com. She can set up a nutritional service for your patients to help achieve optimum health, and it costs you nothing. Zero cost to you, and she will provide these services, and it will be a cash-based revenue stream for your practice. Now, where else are you going to get where you can provide a service that so many Americans need? The obesity rate in this country is ridiculous. Not only the obesity rate, we don't even know what good foods to pick off of the shelf. She will help you with that. She literally took me through the grocery store. She literally will take your clients. She will go to the grocery store with her, and she will show them what to eat, how to evaluate I've never seen anything like it. I've never seen anybody care that much to go that deep. So if you really want to learn about those services, these are the things that I look for. How can I bring something more riveting to a PT practice that other practices just don't have, that people just are looking for, that they're in need of, but they don't even know they exist, and it's a fraction of the cost. So it's things like that, mastering digital social media marketing, mastering your report. I mean, this is in Meg Academy. We teach you all about the social media marketing. And if it's something really in-depth, really broad, we have groups that we like. We like UpDoc Media. We think those guys do a wonderful job. We do an awesome job of defining internal marketing and external marketing. There's farming, there's hunting, there's 2 different things you have to do to bring new patients into your clinic, but you need to understand how to structure that. You need to understand, how do you do the give me 5 drill in your clinic? How do you do the proper success stories in your clinic? How do you utilize surveys in the proper way inside your clinic? That's different from going to a doctor's office, sitting down with the physician and saying, hey, I'm here to share with you an elite service that we provide to our clients that I don't think other clinics provide. And here's what it's all about. And here's where it came from. If you haven't shot a video and put it up on your website yet, where it's an infomercial about, Nicole sitting on the desk and saying, hi, I'm Nicole, Kennedy, and I own, ABC Physical Therapy. And I'm here to introduce you to my clinic and what we're all about. If you're watching this video right now, I know there's 2 things going on in your mind. Number 1, you're probably not feeling well and you're looking for a provider that can help you. And number 2, you probably have a little bit of an anxiety about coming in for therapy. I'm here to make that go away so you feel part of our family day 1 when you walk in our clinic. So follow me, and then the video camera goes with you and you walk around your clinic. These are applicable things. These are plug and play things that will go on your website and will just make you connect with people, immediately connect with them. I know I'm going off on a little bit of a rant here, but I want to get you this data because if you want to learn more, you can literally reach into it. Matthew, he should come up on the screen and just wave and show himself. Matthew said to me, Brian, in this time of crisis, there he is. He said to me, in this time of crisis, you know what? Everybody, you guys are going to great lengths trying to help all of these owners across the country. He goes, I have an idea of how I can help these owners. I think I can help these owners by providing a website facelift. I'll assess their website, I'll evaluate what's good and bad, and I'll give them a I'll give them a facelift on their website. Matthew's like, wait, I didn't say free. He said he'll look at what he said, he'll look at what the market rate is on doing that service and he'll cut it in half. He said, that's how I can give back to all of our clients and all of our public because people are hurting right now. But we know where there's going to be a robust economy of patients that are in big need coming in another 90 days, 120 days, maybe even sooner. Trump's talking about by Easter, he wants to see the floodgates open up again. I hope that happens. Oh my gosh, I hope that happens. But Matthew's like, I can participate in helping out you therapists, you and Nicole and Mike. You guys don't have to. I will do their website facelift at 50% of what the traditional people in this industry will do it for. So take advantage of this generosity. Take advantage of some of these things I've talked about. I know I went fast. I know we don't have a lot of time, but simply by doing better management and having a career development training program inside your clinic, it's going to change everything for your personnel. Learn about that. And Nicole, Mike, I'll let you guys chime in because I've been talking about it.
I know we have a lot of clients on here, and I'm the coach to some of you, and I know a lot of our clients have been clinicians first. You know, they are working in their business instead of on their business, and have been working hard to do the latter. And now is the time more than ever for you to put together your business strategic plan, for you to really get into that policy and procedure manual that you might have been kind of pushing to the side, to take some, actions now that hopefully in a month or two, whatever it is from now, that you can kind of hit the ground running once we do kind of open those doors back up and get ready to treat patients again. So it's a good idea to do your Meg Academy training now, work on your CEO skill set so that, you can come back with an even better product or better service a couple months from now.
That's important.
I think I would just say that, when my mom was alive, one of the best quotes she ever said is, she goes, Michael, there's nothing so good that bad can't come out of it, and there's nothing so bad that good can't come out of it. And this is a terrible time in the world, but I've been so encouraged because so many of the clients I work with are, using this time to get their staff to do their Meg Academy training. These could be startups, and they're using this time smart. And we just have to prepare for, yes, it's going to be a tough 2, 3, 4 months. But when the floodgates open, we want you guys to be right there and let everyone flood into your clinics. So be proactive and do a lot of community outreach and give. Don't take now. We should never take, but a great book, Brian can tell me who it's by, but it's Jab, 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 Hook. Give. And if you give, then you will get back. But now is not our time to get. It's our time.
That's absolutely right. That's absolutely right. And I'm just going to say,
speaking of give, because I know that's one of the other things that we talked about, Brian, is, what can we do for our people? And one of the things that we've just done recently is develop these certification programs. And a lot of you, as I said, are Meg Academy clients already, and that there's specific user fees for the bundled packages that we have. So for 1 to 10 employees. And what we've decided to do during this time, and we're going to make it available for, a short period of time, like, within the next week here, you would have to make the purchase, but we are going to make it available, those particular packages at half off. So that if you want your staff to be training, and even if they're furloughed, that's not considered on the clock stuff. This is continuing education, this career development training. You can have this available to you at half price. And again, this is limited time only, and I'm sorry, it doesn't apply to people that have already made the purchase. But we do want to do something for our people to make this training more accessible during this time. So if you wanted to upgrade and you wanted more, then, you would get that at half price.
And you know what, let's say this. Let's say somebody purchased it like a week ago or something, and they just missed out on the discount. You know what? I am willing to give of my time free of charge to do a free consultation with anybody like that, Nicole. So if you have somebody in mind that you want to earmark and they want to sit, and I can go through and give them specific front desk handling, specific marketing things, specific, it is time to give. You need to read the Go Getter book. You need to get it on audio. You need to listen to it 5 times over. That is the philosophy of our company. We're not here to sell you anything. I know you hear us talking about our stuff. It's our product. It's what we have changed people's lives with. I had 3 people buy the startup, buy all Meg Academy, and they're starting up because they're saying, Brian, is this a good time to open up a clinic? I'm like, this is the best time to open up a clinic. How could you pick a better time to open up a clinic? Because if you're going to go and get trained on how to open up a clinic, you're going to be ahead of the needs. So you're going to have all the knowledge ahead of the time that you need to drop it. And if you're going to open up, the soonest you're going to open up, if you just got engaged today, is 4 to 6 months from now. That is, you're going to get the best rentals. You're going to get the best building spaces. You're going to get the best prices on equipment. It's literally the best time if you're ready to change your life and get out there and say, let's do it. It's the same reason when everyone's selling on the stock market, that's when you're buying, right? It's the same concept. Don't have emotion to money. Look, I'm going to end with this because I don't want this to be about us. I just want to say this. Think about what you've been doing that led us into this crisis. You had nothing to do with it. It came upon your head, but this is an opportunity for you to say to yourself, if I go back and I keep doing what I've been doing, I'm going to keep getting what I've got. Only when you're willing to change what you've been doing are you going to have the opportunity to change that life and live that work-life balance. That's what it means to us. If we can give you discounts, we can help save you some money, some time, connect you to some of the great people we work with. Like you heard Daniel chime in, Sarah's chiming in. Use us. We want to be the Google of physical therapy for your benefit. So that's all I have to say on this episode. I think we covered, a lot from the last episode and these 6 points of how to restructure. I have a lot more to offer you. Nicole has a lot more to demo for you, how you can use these 6 points in greater detail, but we're going to leave it up to you to change your life by reaching in and learning more. Knowledge plus responsibility equals control. Don't forget that. Knowledge plus responsibility enhances your control, and more control means a greater life. So that's my 2 cents.
All right. Thanks, guys.
Matthew, anything to offer?
Nope, just if you guys came in late to the meeting, I saw we had a couple people say some things. This recording will be available live tomorrow. I'll send it out via email. It'll also be on our Facebook pages and as well as the May Business Resource page for COVID-19. You can find that link on the main homepage of our website.
Yeah, and thank you for
Thanks,
everybody
guys.
chiming in. Thank you, Jeremy. Thank you, Sarah. Thank you, everybody. Thank you, Daniel.
Thanks, guys.
Take care, everybody. Good night.
Bye.
Bye.